Yes, you keep putting Obamacare down when there's a president who's trying to help all the poor people and the hardworking people. You put Obamacare down when it is the law. It was passed throughout the law. It is the law, and yet the Republicans are trying to kill this wonderful thing that Obama is trying to do for us. And another thing, Senator, can you tell me in detail what kind of insurance you have and who pays for it if it's not the taxpayer?
Okay. Well, first of all, John, what we're seeing is that Obamacare was passed on a very partisan basis, and even President Obama's union backers are really taking a look at this law and going, there are a lot of problems with this bill. It's just not ready for prime time. It's not going to work as it was advertised. I mean, President Obama claimed if you like your health care plan, you can keep it. Well, that's not true. He said that when you pass Obamacare, the cost of a family premium would actually decline by $2,500 during his first term. It's actually up about $2,500 to $3,000. So there are an awful lot of broken promises, a lot of promises made on Obamacare, and they're just not being borne out. You know, John, we are a compassionate society. We truly are. You know, we want a strong social safety net. The problem is, how do you design that social safety net that's confined to the people that truly need it, where it doesn't creep into, you know, the population of people that don't need it, take advantage of it, and in so doing bankrupt our nation? One of our problems, the thing that I'm really concerned about, is our national debt is almost $17 trillion. It exceeds the size of our economy. And if we hit a debt crisis, if interest rates spike, if we just go back, Pedro, to the 30-year average interest rate of 5.3% from 1970 to 1999, that would add more than $600 billion per year to our interest payment. That's what we spend on defense. It's actually more than we spend on Medicare. So, you know, listen, it's not that I'm not compassionate. It's not that I don't want to help people that can't help themselves or help people help themselves. It's just that I am incredibly concerned that if this nation's going bankrupt, we're the world's reserve currency, we can print money, but that won't go on forever. And if we have a debt crisis and interest rates spike, I mean, all of this government spending that people are reliant on is going to really be put at risk. So again, I'm just trying to be fiscally responsible and trying to avoid some sort of financial calamity somewhere in the future if we don't get these costs and these welfare programs under control.
You're mentioned by the former Education Secretary today, Bill Bennett, in his column in the Wall Street Journal, saying that you have already set aside money in your budget to help supplement health care costs for your own staff.
Yeah, I'm a business guy. You know, you come here from the private sector and you get a budget for staff, and you realize that budget doesn't even have to pay for benefits. Something else magically takes care of that. So, you know, most members of Congress don't have a clue how much the benefits cost for the people they employ in their staff. So I realized this was happening. I realized it was the very clear intent of Congress when they passed Obamacare to make sure that members of Congress and their staff purchase their insurance through the exchanges, just like other millions of Americans are going to probably lose their health benefits and have to access health care through the exchanges. And again, very explicitly, Congress did not allow the federal government to make payments into those exchanges unless they qualified for the subsidies based on their income. So again, that was very clear intent. So, I mean, I recognize the law as it is. So what I have done consistently is I've actually not spent more than $500,000 per year of my budget. First of all, just be fiscally responsible, but also realizing at some point in time this law was going to kick in, and I was going to have to do something in terms of helping the people that work with me provide, pay for their health care. Because I've run business for 31 years. I always made sure that the people that work with me had good health coverage, and I always had the exact same health coverage as everybody that I employed.
This roll call headline says that you may sue over the carve-out as it's known.
Right. Again, I do not believe the president has the legal authority to, just go ahead and institute this policy from OPM that is going to allow the federal government to make contributions for health care in the exchanges. That is special treatment. There will be millions of Americans that lose their health care because of Obamacare. When they lose that health care and they've got to buy their coverage through the exchanges, the only subsidy they'll get is what's allowed based on their income, except for members of Congress and the staff. Then the federal government, their employer, will be able to help pay for that health care. That's the way the law is written. President Obama has circumvented that without the legal authority. So yeah, what I intend to do if that law is actually implemented, I believe I will have legal standing to sue to overturn that ruling, which I think would be the right thing to do.
The Wall Street Journal editorial says that your colleague, Senator David Vitter, made an effort to to make sure that members of Congress and staff live
Right.
under it. Why didn't that gain traction?
Well, because I think most members are apoplectic about losing that their employer-sponsored care for their staff because they think they're going to be losing staff, and they just might. But again, that was the express intent of Congress. If you take a look at the legislative history, the amendments that were offered that were rejected by the Democrats, in the end, it sure seems to me like the clear intent was make members of Congress or staff purchase health care through the exchange and not allow the federal government to make contributions to that health coverage. So you either follow the law or you change the law. You don't do it through regulatory fiat like the president's done where he has no legal authority.
Here is Tacoma, Washington. This is Nancy, Republican line. Hello.
Hello.
Hello, Nancy.
Hello. I'm retired military, and I didn't hear what you just said. I saw your mouth move. But
Just go ahead, Nancy. You're on the air. Go ahead with your question or comment, please.
Okay. Hello, Senator. I want you to get behind Senator Cruz. I don't care what he's saying or what he's doing. Get behind him for the American people. This is an unjust and illegal law. This is not about health care. It's about insurance. Now, you have the power to regulate commerce, which it applied to this law. The children age 26 can stay on their parents' insurance. They cannot deny you for existing conditions, and a number of other things that are very well welcome to the American public. That was regulating the insurance companies. But then the Democrat Party decided to punish the American people. They decided to mandate. In other words, you have to purchase something you do not want and do not need. Then the Supreme Court changed the wording and made it a tax. Now, I want you to get behind Senator Cruz and stand your ground.
Okay.
Thank you.
Well, Nancy, first of all, every Republican, every conservative is absolutely united in wanting to repeal, defund, prevent, really limit the damage of Obamacare on our healthcare system and our economy. But the sad fact of the matter is, President Obama was reelected. John Roberts ruled. He was the swing vote in saying that Obamacare was constitutional. I didn't agree with that ruling. So you have to take a look at the political reality of the situation, and what we need to do now as Republicans and conservatives is we need to paint that picture of what Obamacare is really going to mean to our health care system. We've got to get the supermajority support of the American people to at least maybe start having Democrats think about voting for repeal, or we're going to have to start winning elections. We're going to need more votes in the Senate to actually have repeal. And again, what we better really do is win 2016, and that's probably our best chance of actually finally totally repealing Obamacare. But again, it's a political process. You have to inform, you have to persuade, you have to win the argument, and the sad fact is we don't have a supermajority of Americans yet putting pressure on Washington to fully repeal this law.
But if you want all that to happen, then what about Senator Cruz's approach to this whole thing?
Well,
Threatening filibusters and the like.
Well,
because
again,
it has to impact that.
I don't see how that leads to a successful defunding of the bill, because what you have to do is you actually have to pass a bill through the Senate that defunds Obamacare. This isn't a situation, I think some people were misled early on, that because we supposedly have the power of the purse. Well, we have the power of about 1/3 of the purse. But this isn't a situation where if the House fails to pass a CR, Obamacare necessarily gets defunded. No, it's all already fully funded in that other 2/3 of mandatory spending. So you actually have to pass a law through the Senate, which means Harry Reid's got to cooperate, and we've got to find currently 5 Democratic senators, in about a month or so, 6 Democratic senators. When we lose the seat, or we potentially lose the seat in New Jersey, we need to have those people join with Republicans to repeal and defund Obamacare. So far, not one Democrat in either chamber has ever broken ranks on voting to repeal Obamacare. I don't think that the political dynamic has changed recently.
Senator Reid took to the floor of the House yesterday to talk about issues that will be playing out for this week, and talking specifically about House Republicans, the influence of the Tea Party about the president's health care law. Here's what he had to say.
Inside the House Republican bubble, the crowd cheered a plan to deny health insurance to tens of millions of Americans, or else shut down the government. Outside the House Republican bubble, Our action was altogether different. The radical Tea Party plan to shut down the government unless Democrats agree to deny funding to implement Obamacare, passed by the House of Representatives on Friday, has been called the dumbest idea ever by one Republican senator. It's been called a box canyon, a morass from which Republicans will not escape unscathed, by a second Republican senator. It's been called dishonest by one Republican senator and a suicide note by another Republican senator. So, Mr. President, the reviews are in, and they're universal. The ransom demanded by House Republicans in exchange for keeping the government open is unworkable and unrealistic.
Senator Johnson.
You know, part of the big problem that Obamacare has is that it was jammed through on a totally partisan basis. You know, how would I start out? If you really want to try and negotiate something, if you want to really accomplish something, you got to figure out what you agree on. Obviously, back in 2010, when this law was passed, or 2009, 2010, there wasn't that coming together. There wasn't that compromise. This was jammed through on a totally partisan basis, and so the American people have been totally divided on this thing ever since. It's really why I ran for election. It's really what produced that wave of Tea Party candidates that won in 2010. Certainly on our side, there's a high level of frustration that we have not, that John Roberts, from our standpoint, ruled the wrong way, that this law still is in place. And so you're seeing that frustration level play out here. What I'd like to do is, again, have everybody take a look at the reality of the situation. I'd like Democrats to take a look at the fact that their union backers are realizing this law has many, many damaging effects. I'd like certainly conservatives, Republicans to recognize that we didn't win the 2012 election. Harry Reid's still in the Senate, so we've got to recognize that reality. Let's start informing the American public. In the end, this all goes back to the American people. What are they going to want? And I think if Republicans, I'd say if the medical community, if we start painting the picture, because listen, I'm talking to doctors, they are really concerned about what's going to happen in terms of their ability to deliver quality health care. Because how do you do this? Just from a macroeconomic standpoint, Obamacare promises to really dramatically increase the demand for health care. What's 30 million more Americans getting health care that apparently didn't have it in the past? It's not exactly true, but again, 30 million more people demanding health care while we dramatically reduce the supply. The current budget window, we are going to remove $716 billion out of Medicare. That's reducing the supply. That is not an economic prescription for reducing costs. That's an economic prescription for a market disaster, rationing, lower quality care. And I think that's the kind of picture that Republicans and conservatives need to paint for the American public so that we can repeal this bill before it does really damage our healthcare system and our budget.
Vivian Shepardson off of Twitter says, why delay a year? Why not implement it, fix the parts that aren't working?
Well, honestly, that just may be the default position. I'm thinking possibly we can convince our Democratic colleagues who also recognize this thing's not ready for prime time. Again, President Obama is delaying all kinds of different parts of this bill. The bureaucracy is not ready to implement this law. Why don't we take a pause? Why don't we collectively say, this isn't ready, let's wait a year. We'll give the bureaucracy a little bit more time. We can be talking to our Democratic colleagues about, okay, what are the most harmful aspects? For example, look at the medical device tax. 79 senators voted to repeal that during our budget process because they're starting to see that when you tax medical device sales 2.3%, we've virtually stopped investing in new medical device manufacturing here in the United States. That is shipping jobs overseas. Even Democrat senators recognize that thing. So maybe what we need to be doing over the next year is remove the most damaging aspects of Obamacare, while again, certainly from a Republican standpoint, I'd be arguing to let's repeal the whole thing. It's going to be difficult to just piecemeal this thing and make it better. It's just a disaster. More than 20,000 pages now of law, rules, and regulation, and they're only about half done writing this law, which is part of the problem. They've had 3.5 years to implement it. They've only written about half of the regulations. That's kind of a problem, isn't it?
Here is Clyde from Front Royal, Virginia, on our others line here on with Senator Ron Johnson.
Hello, Senator Ron Johnson. How you doing?
Real good. And yourself?
Oh, just great. I've got a real peeve about this insurance thing, Obama. I thought, I said, go Obama. Wow, he's going to fix health care. I thought that they were going to maybe somehow get the hospitals and doctors to not charge so much. But for years and years, insurance has been like a real problem with everybody, okay? The doctors have to get a staff just to fill out the forms for regular insurance. Hospitals charge more. you know, even in my industry, I do heating and air conditioning. When the insurance is involved, you just automatically charge a little bit more. Pet hospitals used to be you could take your pet. Now you got to have insurance for your pet, and it's probably going to be mandatory. Which mandatory is a term I wasn't really sure what it was, but I'm very sure what it is now. It seems like we see a lot of mandatory all the time. I just think, personally, years ago, my wife had to go in the hospital, and they paid, it was like a $2,000 bill. I'd have insurance for years. First time, we very seldom go to the doctor, and they said, well, you have, we're only going to pay $900 because you have an accelerated deductible because you never use your insurance. So I dropped it. I never felt better.
So guest,
I refused to get it.
So
know?
caller, would you mind your question or comment for the senator, please?
Oh, I guess I'm just ranting and raving. I'm totally against Obamacare. I think the government should not be an insurance company, and I hope you guys can defund it or whatever the hell it takes to get rid of it, you know?
Caller, we'll leave it there. Thank you.
Well, you know, part of the problem that Clyde is describing is the government's involvement into health care. Now the government pays roughly 40 to 50% of all health care, and they don't pay it at reimbursable rates in many cases that even cover the cost of hospitals. So what do hospitals and healthcare providers do? They shift those costs to the private sector, which is one of the reasons private insurance rates have skyrocketed. I mean, it's that cost shifting because of government's involvement. Another part of the root cause, and I'm a manufacturer, you always go back to the root cause, is back in the 40s and 50s, we started moving far more to a third-party payer system. I think the stats are back in the late 40s, 68 cents of every healthcare dollar was actually spent by the actual patient, the consumer of the product. So there's involvement in making those consumer choices. Now only 12 cents of every dollar is paid for by the patient. 88 cents of every healthcare dollar is paid by somebody else. And so people don't even know what things cost, much less are particularly concerned about what it is. By removing the consumer of the product out of the process, from separating them from the payment of the product, we've taken the free market discipline in terms of controlling costs. And you take a look at the two areas where government has really gotten involved: healthcare and education. Those are two areas of our economy whose costs have skyrocketed in relation to the rest of inflation. You know, I give my little PowerPoint all the time in terms of cost of college. Because of government's involvement, we've gone, cost of college since the 60s has increased at 2.4 times the rate of inflation. You know, healthcare has similar types of outsized cost increases versus regular inflation. You go, well, what's so different, for example, with what colleges and universities spend their money on, that their costs would increase at 2.4 times the rate of inflation? Well, government involvement. We've poured money into education. And you know, we've enticed our children to collectively incur $1 trillion worth of student loan debt. Again, government involvement, it's always well-intentioned, but there are always some very serious negative consequences because you just simply can't command an economy. And we've seen, you know, Soviet Union wasn't able to do it. Venezuela's a basket case. I always point out how many people vacation in the island paradise of Cuba. And these economic models where the federal government takes over, or any government takes over huge sections of the economy, they fail, they collapse, it doesn't work.
Here is Herman, Pittsburgh, Pennsylvania, Democrats line.
Good morning. How are you doing?
Real good.
From the day this bill was passed, Republicans have been crying the blues about this bill. Please, answer this question. If people re-elected President Obama, and there's an election between you and the Republicans, and the Democrats won, why do you want to change the democratic system and repeal this bill? Because you don't like it. That doesn't make sense. We've heard your story for over 3 or 4 years now. We know all the negatives. Please, why don't you start talking about the positives of the program? Thank you.
Okay. Well, first of all, unfortunately, from my standpoint, the 2012 election was not run as a mandate to repeal Obamacare. It was just sort of shoved off to the side. We talked about other things. The fact of the matter is all those promises that President Obama made. I mean, in terms of family rates coming down $2,500, they've increased by $2,500. You know, if you like your health care plan, you keep it. You can't. Those promises are being broken. And so, I think those are just some basic facts. And the truth of the matter is, as well, is President Obama very cleverly, but I would say quite cynically, delayed the implementation of the health care law until after his election. what he's actually doing now is delaying some other pretty bad parts of this bill until after the 2014 election. So, I've seen polls where 40% of Americans don't even realize that Obamacare is the law of the land. As we're moving toward implementation now, people are just for the first time recognizing, ooh, this isn't quite as good as it was advertised. I mean, these promises are being broken, and they're going to start seeing the very negative consequences of the health care law. That's just a fact. And so, from our standpoint, I'm trying to be pretty even keeled about this. I'm trying to be as reasonable as possible in terms of let's take a look at the facts. Let's take a look at the damage that Obamacare will cause to our healthcare system. I'm happy to reach out and work with Democratic colleagues to certainly remove the most damaging aspects, things like repealing that medical device tax so that we can start investing in medical device manufacturers again in America. But again, it does have to be a two-way street. I'm more than willing to have those types of discussions.
Kelly up next from DeSoto, Texas, Independent Line.
Yes, hello. Thank you for taking my call. I would like to respond to something Mr. Johnson said earlier, and that was that I believe Republicans and conservatives particularly need to very clearly point out more of the actual damage. And I have three specific things I'd like to be constantly addressed. And the first one is the huge increase in deductibles. We got a note from our health care provider that our deductibles are going to be raised to $10,000 per person. That's $20,000. Our premiums are going to be going up over 300%. So we're looking at $32,000 a year to keep the same kind of health insurance coverage we have now. The second huge thing was actually discussed today on another channel by the CEO of the Mayo Clinic, and that is the huge increase in out-of-pocket expenses, because he said that many people are not realizing while you may get a decrease in your premium, your deductible, and your out-of-pocket expenses. And he said when you come to the Mayo Clinic, huge amounts of things that were covered in the past are now going to have to be paid out of pocket. And the third main gorilla in the room, I believe, is what many people do not believe, and that is the huge impact that the Independent Payment Advisory Board could have on senior citizens. I think it's a sad state of affair when our country is going to be looking to just a few appointed people who may or may not even have anything to do in the medical field, and they will have control over every citizen in the world care simply by the stroke of a pen.
Paula, thank you.
Well, we saw an inkling of what the Independent Payment Advisory Board is going to be looking like. I think it was called the U.S. Preventative Service Task Force. When they took a look at data showing that women under 50 probably shouldn't get a mammogram because, it'll save a few lives, but not enough to really justify the cost. Now that's a government unit making that call when I believe individuals ought to be able to have the freedom to make that decision themselves. And unfortunately, the IPAB, to use the shortened form, is from my standpoint, that's really the rationing board. I mean, that is really their function. Take a look, 15 unelected bureaucrats taking a look at, healthcare outcomes and saying, well, Americans really, we shouldn't be utilizing that treatment. We'll make that decision. I think that's just the wrong way to go. I mean, what has made this country great is really a free market competitive system where you have millions of consumers making millions of individual consumer choices, just determining what level of quality, what level of service, what kind of price they want to pay for whatever they buy. One thing I always try and point out, what a free market competitive system guarantees is the lowest possible price and cost, the highest possible level of quality, the highest possible level of customer service. It just does. I mean, I was in business. Did I like competition? No, but I knew it provided exactly that type of discipline to my business. That's what we want for our healthcare system as well. But we've basically removed the free market competitive system when you've got 88 cents for every dollar being paid by somebody else, and we just don't have that consumer connected with paying the product anymore.
What should be done about the debt ceiling?
Well, first of all, we should, anytime the President of the United States comes to Congress and asks for the authority to increase the debt burden on our children and grandchildren, that ought to be a very serious discussion. That ought to be a debate. And I believe when we're facing the types of deficits over the next 30 years, and we can get into that a little bit too, in terms of we don't have a 10-year budget window. We've got a 10-year budget problem. We've got a 30-year demographic problem. The baby boom generation that politicians from both parties have made promise after promise after promise But the problem is they didn't provide, make the provision for paying for those promises. As part of my work with the White House, trying to come to grips on what we need to do with our debt and deficit, we ran a projection. And we've all seen the hockey stick graphs, and always accompanied by something that's, well, at that point the model blows up. No, it doesn't. We've run the models. They just produce very big, scary numbers. Our most realistic number showed 30-year deficits of $107 trillion. Primarily driven by Medicare. It's about a $36 trillion deficit in Medicare, about $11 trillion deficit in Social Security. So you can't take those things off the table. You must address the long-term drivers of our debt and deficit, and we should be doing that probably around the debt ceiling, where we have that very serious discussion. But it starts with, what do we agree on? We need to agree on the extent of the problem. And most people here in Washington just put their head in the sand. They don't want to look at the numbers because they are big, they are scary. And so instead, they talk about these problems with demagoguery. Paul Ryan, whether you like his proposal or not, it's a real proposal in terms of what we can do to save Medicare for future generations. The other side runs ads with the Paul Ryan lookalike pushing Granny off the cliff. Now, I don't see how that helps us move toward a solution. What would help us move toward a solution is let's agree on the size of the problem over 30 years. Then let's start, I always call it a solution menu. Kind of on a no-fault basis. Let's start having a way of looking at this over 30 years, decade by decade. Let's say we start recognizing that the population now lives a lot longer. We need to start factoring that truth into our entitlement programs, and we should start laying out, well, if we were to adjust retirement age, from 65 or 67 to X over X number of years, how much of that $107 trillion deficit would that solve? Let's get the think tanks, let's get smart people, some actuarial experts to start scoring the possible solutions, the solution options, so then the American people are informed, and quite honestly, members of Congress are informed about what the challenges are we face and what possible solutions there are to actually meet those challenges.
On the House side, talk of raising the debt ceiling to not funding the Affordable Care Act for a year. Your thoughts?
Well, I tell you what, how about a one-year delay? Again, from my standpoint, President Obama has already acknowledged, like I said, that this thing is not ready for prime time. He's delaying all kinds of parts of this bill without the legal authority to do so, I might add. So why don't we
But tied to debt ceiling?
Why not? Again, we need to have that very serious discussion. Part of our projections show that Obamacare will cost about $13 trillion over the next 30 years. Now, I realize those are projections. Who knows what it's actually going to cost, but it gives you some sort of sense how expensive Obamacare is going to be. Now, I already talked about Social Security and Medicare, how those things combined are going to be about $47 trillion of deficit spending over the next 30 years. How can we afford another $13 trillion? And again, nobody really talks those numbers. We're all confined to this 10-year budget window where people say, well, the problem is about a $4 or $5 trillion problem. Well, that maybe stabilize the debt over the next 10 years. What happens in the 11th, 12th, and beyond? I got white hair. 30 years used to seem like a real long time. It's not. It's going to be honest in no time. The time to start addressing these enormous fiscal challenges is now, but you have to do it with real information. It's a fiscal problem. You actually have to start looking at numbers, and I realize people's eyes glaze over real quick when we start talking about numbers, but that's what we need to grapple with is, what's the numerical problem and what's the numerical parts of the solution.
Here is James from Carmel, Indiana, Democrats line.
Good morning, Senator. Good morning.
Good morning, James.
I have a question about the health care system that you want to repeal. We need a health care system. I remember in the 60s when my wife had an insurance plan and I had an insurance plan. It's like we both owned insurance plans separately, but they covered each other of us. So, it's just like you buy two products and you get two items for it. Well, they used to pay double. If we had a $1,000 insurance, we'd get $2,000 from our insurance company. Well, the insurance companies finally found out there's a way to get together and stop that, and they did. Now, even though we pay for two plans, we only get the service of 1 and a 20th or something like that. But now I've seen health just decline and decline and decline. I have cancer now, and it's going to be harder for me to get health care insurance in the future. And everybody wants to repeal Obamacare because it's not a good plan. And I would like you guys in the Senate and Congress to come up with a better plan and replace Obamacare rather than repeal it. We need something. I'm tired of going to the emergency room and seeing hundreds of people in there just going in there for common doctor appointments that have no insurance, that will never pay. A lot of them are illegals, but they don't turn them away. They just raise the cost of my insurance.
James, thank you.
Well, James, there's an awful lot of cost shifting, and you mentioned the 60s. What happened in the 60s? We instituted Medicare. Now, when they initially passed Medicare, they projected out 25 years and said that Medicare would cost, I think, $12 billion in 1990. It ended up costing $109 billion, almost 10 times the original estimate. And again, what's ended up happening is the federal government has got involved in health care. We've produced all that cost shifting that has driven up private insurance rates. We're basically subsidizing the government care within Medicare. So to me, that's part of the root cause of the problem. So let's, instead of increasing government's involvement in health care, let's start decreasing it over time, again, slowly. Put ourselves on a path, recognizing this is the system we have. Let's not do anything that shocks the system, but over time recognize that the only way you truly contain costs, the only way you truly improve quality and customer service is through that free market competitive system where individuals are in greater control over their own health care spending. And it was a shame about Obamacare from my standpoint. I provided health care for 31 years. Over the last 3 years of my involvement in my business, we shifted to higher deductible plans to reduce premiums, but I didn't pocket those premium savings. I invested them in HSAs. Within 3 years, every one of the people that worked with me had $5,000 that was their money in their HSA account to pay for those first dollar coverages. And this is how the marketplace responded to that. Because of HSAs, you had Walgreens, Walmart, CVS, develop walk-in clinics staffed by nurse practitioners. It's sort of that first step in a triage of medical care. So instead of, as a parent, taking your child into an emergency room, they are clogged. It's a real problem. Now the marketplace gave you an option to go into to Walmart. Rather than pay $200 for an emergency room visit, now you can go to Walmart, see a nurse practitioner, get your kid's ear infection diagnosed for $35. The free market is a marvel. It works really well. We need to rely more on that type of freedom in the free market system rather than look to the federal government to solve the problem, because look at how much harm they've done to our healthcare system since the 60s. Again, we want to provide a strong social safety net. We want to make sure that elderly individuals have good quality health care. But we're not going to have that system if government takes it over. We'd be far better off with more individuals making those consumer choices.
We have to finish up, but what's the timetable that you expect starting on Wednesday as far as a vote is concerned?
I mean, nobody knows. I mean, that's the problem. Just coming from the private sector, it drives me nuts, the utter dysfunction of this place. That it's not like September 30th is a surprise. I was talking to my colleagues about let's get a CR passed before we left on August break. If you want to defund Obamacare, let's do it. Let's throw that on there. Let's debate it. Let's have that discussion. But let's be prepared to, in the end, negotiate and compromise so that we don't threaten the government shutdown. But that's not what we're in right now. Maybe the thing to do is pass a couple short-term CRs. From my standpoint, again, I'd like to work with people across the aisle. Let's fund the things that we agree on. Let's get that done. Let's get this big shutdown off the table. If there's some things we disagree about, let's leave that. But I think that's going to be a pretty small part of that budget. I think that'd be a far better approach than playing all this brinkmanship.
Senator Ron Johnson, Republican from Wisconsin, thanks for your time.
Thank you.